Hi, everyone. Thank you so much for attending our first Facebook Live of INR session. This was really a way for us to feel connected to our clients and be able to access you guys a bit more easily. For those of you who don't know, my name is Maria Moreno, and I'm here with my colleague, Shannon Harrison. We are some of the Information and Referral Associates at Parkinson Canada. So thank you for joining us. This is our first time doing this, so thank you in advance for your patience as we try this out for the first time. Just before we get started, I want to just explain how this is going to work. So Shannon and I are here to answer your questions. You can type them into the comment box for those of you who attended the Dr. Grimes Facebook event. It's very similar. While we're going, I'm going to be reading out the questions to Shannon and we're going to talk them out. But if at any point, maybe it doesn't seem like I'm fully paying attention in the conversation or I have a scrunched up look on my face, that's just because I'm reading the questions and trying to follow along with you guys. So don't be concerned. We're going to try our best to make these questions as relevant to everyone as possible. So if you ask a question that's really specific to an individual case, I might rephrase it a little bit just so it has more broader relevance. Also, we're talking to a lot of people. Hello to everyone. And so not all questions may be appropriate for this kind of platform. So if we don't answer your question, or maybe just because we don't have time to get to all the questions today, we do have our helpline. We have an email and a phone line that you can call, and then we can get to your question on a one-on-one level if we're not able to get to it today. I know I've already talked a lot, but there is just one more thing I want to say before we get started, and it's really important. So this is a chat and this is a conversation, but it's really just meant to be general information about Parkinson's, and it shouldn't be taken as medical advice. Someone could ask a question about a symptom, and we could talk about how it relates to Parkinson's and give a perfect answer about how it relates to Parkinson's, but that individual might have a completely other health condition we're not aware of because we're talking through a chat, and that could be causing the symptoms, or there could be a number of reasons for a symptom. So that's why it's really always important to go back and talk to your healthcare professional before making any changes to your treatment plan. I know I'm on the phone with you guys, so I know accessing healthcare professionals can be challenging sometimes, and especially with the pandemic, some doctors aren't available, some healthcare professionals are doing different platforms to reach patients right now. So I completely understand that saying that is much easier said than done, but I still think it's really important, and as much as it takes more effort, it's still really critical that you reach out to talk to your healthcare professional before making any changes, just so we're making sure we're absolutely safe. So with everything outlined, we're going to get started. Shannon, how are you doing?
I'm good. Glad to be here, and welcome to everybody else that's joining us. I'm really glad to be able to connect with you in this way, and just to be able to, to feel a part of our family here. So great.
Yeah.
So for those of you who don't know me, I work in the Ottawa office. I'm there part-time, and I've been there for about 3 years now, and really enjoying learning from you who have Parkinson's, and my colleagues too. It's been really great. So I hope that this will be beneficial for you, and we will soon get started.
Awesome. So one of the questions, Shannon, that we're hearing a lot lately is really about clients calling. They may have someone that they're caring for with Parkinson's who might be in the hospital, might be in a retirement or long-term care facility, and they're not able to access them at the moment. What are your thoughts on that?
Wow, that's really near and dear to my heart, because that's something that I have experienced. Not with somebody with Parkinson's, but just that frustration, that helpless feeling of not being able to get in touch with that person, whether it's a retirement home or a long-term care home. Really challenging. You just feel helpless and not being able to be with them, to support them through their loneliness. We had, been talking about this a little bit and come up with some ideas that may be helpful. I know that a lot of long-term care homes right now will be are offering FaceTime or Skype or videoing. Some places I've spoke to, they've actually have a schedule where you can sign up and then schedule a FaceTime with your loved one. So I think that's really positive, and they're trying to, really accommodate everybody. I think it's a very challenging time for sure.
Absolutely. This is a unique situation we haven't been in before. The rules per public health say that for long-term care, there are no visitors allowed except for essential visitors. So that means visitors if someone is sick or palliative. Those are kind of the distinctions from public health. But that's really hard. And so those are great suggestions that we're saying to clients, talking by phone, if video is possible, these alternatives, and maybe just increasing the regularity of connecting with, people who are maybe inside. But I think, again, it's about really remembering, as Shannon said, that this is a unique circumstance, and, acknowledging that you're doing the best that you can within the confines of these rules and these laws, and to make sure you're giving yourself some credit, and acknowledging that you are trying and we're making it work however we can.
Yeah, I think you have to always remember too, you're doing this for them. It's to protect them and protect these people that are so vulnerable. And but I just really empathize with you all and know how difficult it is just to have that separation. One thing I was thinking about too, if there's something special that you do with your loved one when you see them, maybe it's a hand rub, maybe it's a back rub, whatever, something little special thing you do, you could talk to the staff about it and see if maybe someone would have a minute. Just, okay, here, I'm going to give you a little hand massage today. It's from your daughter, your son, your husband, your wife, and this is, they wanted me to do this for you. So if there's something special that and you can speak with the staff, see if they would do that, I think that could be a meaningful connection too.
That's a really great idea, Shannon. I really like that.
Yeah.
So another question that we're getting is, people are wondering, is it safe to have a PSW coming into your house? We're supposed to be limited socially distancing, especially a lot of our clients are sometimes older. This is a pre-existing condition. So a lot of people are wondering if it's safe to have workers coming into the house. Of course, for people who are using PSW services, they're using them for a reason, on the need there. So it's hard to know what's the right move there. Shannon, what have you been hearing? I know you've been getting some information from nursing newsletters and things like that.
Yes, so my background is nursing, and so I'm a part of the Registered Nurses Association of Ontario. And very timely, they sent out a message yesterday about the concerns about home care. A lot of the masks and gowns and that are going to prioritizing to the hospitals and long-term care. Um, so, I would encourage you to speak with, if you're with the home care company, to speak with your care coordinator, with the manager, to see what measures they're putting in place. All their workers should be screening themselves every single day with those questions of been in contact or having cough or fever. So that's really important. And they're looking into different ways and models of care too, just trying to keep more consistency and having the same person in. So there's things being worked on, and just to really keep it safe. But you need help. You need people to come in and provide that care. They do really good hand washing, and it's so important. If you have masks, gowns, and some people they do have masks and gloves, and they give them to the caregivers so that protect their loved ones. So those are a few of the things that I can go to Maria.
Yeah, sorry, I think my audio was a little breaking up at the end there. But yeah, that's one of the things that's coming up is personal protection. Some of the concerns are that PSWs are not getting access to those things, especially PSWs who are maybe working with private companies. So if you're able to access those kinds of personal protective equipment, gloves or masks or things like that, and provide them to the personal support worker coming into your house, that's great. You're also welcome, to ask them as well the screening questions for your own reassurance. If they've been around anyone who's traveled, if they're aware, if they've been around anyone who has been exposed to COVID-19, you can also ask those questions for your own peace of mind. Um, and then hopefully that is something to help. But it is understanding that, there are essential situations where people do need access to these kinds of healthcare workers. And if you are in that circumstance and you do still need PSWs coming to home, hopefully they're being practical and they're taking the necessary precautions, and you can also check in on that, and if possible provide them with those kinds of supports.
Yes, yeah. If you have a private home care company coming in, don't hesitate to reach out to the manager
Mhm.
and ask them questions for sure, or your care coordinator if it's the government funded home care that you're getting. So,
So, with kind of these conversations going on, people worrying about people coming into the house, people not being able to get out of, their house or their long-term care. I think when we've talked about this before, one of the things that we're noticing in a lot of the kinds of calls that we're receiving is they're really rooted in people feeling really anxious, which I think
well,
even without Parkinson's, I think we're all feeling really anxious right now. I know when I first started, when this all first started, I thought I was navigating everything okay, and I felt okay. And then I noticed I was having so much pain in my back from a previous back injury, and then I realized, oh, outwardly I'm okay, I guess, in how I'm talking, but I think all my anxiety was just tension that I was holding. And I've heard of clients experiencing that as well, more pain recently, but also just a lot of conversations about anxiety. So, one of the things we're talking about a lot is how to try and reduce anxiety. We're hoping to have some series on mindfulness and things like that to help out with clients. And if you're aware of those kinds of resources online, online yoga, we have a Parkinson's connection page that has links to things like Dance for Parkinson's, for yoga, and also exercise, which we always talk about as being so important for the motor symptoms of Parkinson's. But exercise is also really, really helpful for those non-motor symptoms. So feelings of depression or anxiety, exercise can be a big help in that as well. So those are kinds of things that can also be helped by treating using the exercise. Sorry, I'm reading the chat over here and I got see already getting a little side tangent. But exercise can be another way to help for that. So if you guys you can reach it, go on our Parkinson Canada website, and we have a resource page specifically for COVID-19 that lists a lot of those options. We're going to be presenting more of these options moving forward. There's more stuff coming up, but those are some steps to take to help with anxiety. Shannon, anything else in there?
um, I think we're having that mindfulness presentation coming up. And so that's going to, I think, be really helpful just to, it's a technique that can help people relieve that anxiety. But certainly your mention of exercise is just so important to keep active. There's all kinds of options, as Maria mentioned, on our website. There's a resource page. If you can't find it, please call us and we'll just talk you through where to find these resources. And um, I just need to notice here that you're unable to hear me very well. So I'm going to try dialing in. Okay, sorry, just a minute, Maria, and I'll see what I can do about getting my speakers. Is everybody able to hear me okay? Is that,
Oh,
are you
that's
hearing me?
better.
Is that better?
Yeah, sorry. Can you repeat what you were just saying there?
No, I said I'm getting a little notice here saying that my speakers aren't working very well. I'll try to speak louder, and hopefully that will be better. Just saying that, anxiety, we're all feeling it. I'm feeling it too, definitely that muscle tension like you're talking about, Maria. Exercise can be so beneficial for that, just getting active, doing something different in the day, having some plans for the day, whether it's, listening to this person, reaching out to other people, talking, maybe people in your support groups that you connect with, maybe that's the way to connect. And some of our support groups are meeting via Zoom and some through teleconference or telephone line. So that's really going to be great. If you can connect, just call us and we'll be able to connect you with the right people. I was going to mention, exercise in case you didn't hear me before, on our website, and Maria mentioned it too on our resource page. We have many different exercise options that you can do online. There's even a live dance that it's through Zoom. So I think that can be really a different way to connect as well, because that social isolation really contributes to the anxiety.
Yeah, and another conversation that I've had about exercise is people, struggling to stay motivated. A lot of people used to go to gyms, or they had, they do the Dance for Parkinsons in person, or things like that, and so they had a social connection, which is a really big part of exercise for our community as well. So staying motivated at home, I've been talking about that a bit with clients. And if you're able to reach out to the people you used to exercise with, if you know your friends from your gym class, you have their phone number, trying to kind of make each other accountable during this time. Hey, setting a schedule, we're going to exercise at this time every day, or things like that, to try, and or even a family member, someone that you want to keep you accountable, can be really good ways to try and stay motivated. There's also some apps that you can use, if you're a bit more on the tech savvy side, to track your progress as you're exercising, which can be really encouraging. If you exercise for a half hour today, and then your heart, tomorrow it's 45. Those kinds of things can be really encouraging as well. So looking into those kinds of options for self-motivating are also really helpful. One of the questions that we're getting, which also everything I guess sometimes comes back to exercise, is why is sleep affected by Parkinson's? So there are a number of different ways that sleep can be affected by Parkinson's. Some people will feel restlessness or insomnia and have trouble sleeping for that reason. The reason I'm referring to exercise is exercise isn't just, again, about those motor symptoms. It can also help with those non-motor symptoms. So it can help with sleep troubles. It can also help with constipation as well, being active and moving. So it's really just this all around helpful thing for our clients and the types of symptoms that we're used to experiencing. Sleep can also be affected by, something that's really common in Parkinson's is REM sleep behavior disorder. So people who are acting out their dreams. It's because the areas of the brain that are related to sleep are also being affected by Parkinson's. So that's why it's happening. It's also some people, if they're experiencing muscle pain or rigidity because of their motor symptoms, that can make it hard to sleep. When I was having that back pain from the stress tension, the reason I noticed it was much worse was, I was having trouble sleeping because the pain was so severe. And that can happen a lot for our clients. So basically, there are a lot of reasons that sleep can be affected by Parkinson's. The thing to try and figure out is, what sort of symptom are you having? Are you having where your medication is wearing off, you're experiencing pain, you're feeling restless? And once you can pinpoint the kind of type of problem with sleep that you're having, then we can start talking about ways to treat it, whether it's as simple as doing a bit more exercise during the day, whether it requires a medication change. So if you have those kinds of questions, again, to kind of talk that out a bit further, you can give us a call, and we can talk to you about your specific case and the type of sleep disturbance that you're having, and potentially maybe, again, going back to a doctor to talk about maybe adjusting the schedule of your medication or something like that. But there can be a couple of reasons for that. That's definitely not an uncommon. Oh, sorry about that. Just having some technical difficulties. Sorry here. Is it? Oh,
sorry,
are we
my
good?
speaker is going in and out a little bit, and I was dialing in.
Yeah, no worries.
Is that better now?
I think that's better. Yeah.
Okay. Sorry
about that, everyone. Hope everyone.
For the technical problems.
First attempt. There's going to be some hiccups. Next week will be smooth sailing for sure. So yeah, so those are some of the reasons for sleep. Shannon, is there anything else you'd like to add, or?
No, I think you covered it really well. That's very good. Thanks, Maria.
Oh, no worries. So another question that we're getting is, if someone has a friend or family member who lives with Parkinson's, what are some ways that we can support them even though we can't be with them in person? So again, those check-ins, some of the things that we already talked about. Again, if it's appropriate and they feel comfortable, if you want to be the kind of motivator to see if they're exercising and checking in and kind of being their support on that front, that's a huge help. The
Yeah.
kinds of phone calls,
Offering groceries.
Shannon,
Yeah. Sorry, just offering groceries is another thing to keep them protected in their home. Um, Bringing a meal could be an option too.
yeah, exactly. Oh, that's a great suggestion. Getting groceries and stuff like that. Absolutely. Helping people who need to stay inside as much as possible is really helpful as well. And then just the usual, and I mean, that also can be if someone, there's online delivery for groceries. So even setting someone up with that who maybe wouldn't be as familiar with how to do that,
Mm,
not necessarily that you have to make more trips to the groceries yourself. Even just setting someone up with a delivery service for groceries would be a huge help. And then just I think kind of what we've been saying this whole time, just connecting with people in your life, that your friends and family, and just making sure they're okay, just talking more, just making sure people aren't feeling isolated at this time.
right. And I think just ask the person what they need too. They may have another suggestion and something that would be even more helpful to them.
Yeah, that's a great, yeah, exactly, ask people what they need and then work from there. So let me go back to some of the other questions. So we talked about, so some of the other things we got. So one of the questions that was lingering after this session with Dr. Grimes were some people were wondering if we were expecting to have any medication shortages as a result of the pandemic. I don't know that there's any expected shortages at this moment, but one of the things that's maybe been a bit of a source for confusion for our clients is the Canadian Pharmacists Association did make some changes back in March, basically asking that pharmacies only fill prescriptions for 30 days at a time. So if you've gone to the pharmacist and you were used to getting prescriptions for 90 days and you're only getting them for 30 days, it's not because of a shortage, it's just because those have been the directives from the Pharmacy Association, and that's to make sure that we don't have any shortages. So to avoid people stockpiling medications, which could lead to a shortage, they've implemented these rules so you can get your medications renewed for a maximum of 30 days. So they're still circulating in the system. So what they're recommending is that people check their medications and take an inventory. If you're noticing any of your prescriptions are running low, contact your pharmacy. Some of them do delivery service similar to those groceries. But because of everything, we're noticing, grocery delivery services are taking a couple of extra days. There's big waits for that. There might also be some delays in getting prescriptions refilled as well. So make sure you're contacting your pharmacy with lots of notice before your prescription is expected to run out. And then just again, understanding that if you're receiving only a 30-day supply, that's why.
Yes, that's a really good point, Maria. Just be watching that you're not getting too low and give them lots of notice, and then they'll give you that 30-day supply.
Sorry, I'm just doing a quick scroll. um, um, so what are some of the other kinds of questions that you've been hearing lately?
There's been a lot, mostly on exercise, I think, for the people that I've spoken to, and anxiety. Those are the two main things, people wanting to keep active and keep moving. And I think what you mentioned too about having an accountability partner is really important. Speaking to somebody to say, yeah, I'll come along with you and I'll exercise with you. I'm going to call you to see how you're doing, checking in on people. So, and the anxiety is a big piece, and just trying to keep on top of managing everything at home and the worry of the many things going on that are beyond our control. So those are the main things that I'm hearing these days.
Yeah, I agree. It seems like, and a lot of it, we're also hearing a lot of our regular conversations that are sometimes just being situations that are maybe being changed or made a bit more challenging just because of the COVID-19 situation.
Mhm.
So again, the questions that I'm hearing, we're hearing a lot of questions about, accessing a doctor. Even with that sleep question we just had, if the question relates to requiring a change that a doctor needs to approve, and having trouble connecting with the doctor, that's another thing that's causing people some anxiety. If your neurologist isn't available, your family doctor, your community nurse. There's telehealth as well. So there are different options, I think, to get support, even if your regular doctor isn't as available in the ways that they used to be.
Right. The one thing I am hearing, people are connecting with their specialists, that they're doing more telemedicine appointments or telephone appointments. And the people that I'm speaking to have been really pleased with that, just to have that connection with their specialist and with their doctor. So if you haven't heard anything yet, just keep trying. I think slowly people are just getting on board and being able to be there for their patients.
That's great. I'm glad that people are having positive interactions through the telehealth. That's going to be so helpful. Not everyone is able to access their healthcare professionals really easily, or so improving on those kinds of systems might be a really great benefit to come out of this. I know I've been reading articles of movement disorder specialists who've been talking about how to perform the sort of clinical assessment via online video, and giving each other tips and tricks. So people are really trying to work on improving on their skill sets for the telehealth. So it's a exciting opportunity to be coming out of the situation for people where it is challenging to get to their doctor's visits, either due to challenges with mobility or also with distance.
Right, right. And along that line, and Marie, I was trying to fiddle with my phone to improve my speakers, but I'm not sure if you mentioned, but there are some physiotherapists that are doing online assessments and that as well. So you can get in touch with your physiotherapist if you're needing a little bit more guidance on exercise, and they may have that online option up and going, which I think is fantastic, because that's really important to keep all those members of your healthcare team connected to you during this time.
That's a really good point, and especially one of the things that I think we felt uncomfortable with in this new scenario, where we're telling people, and you should, it's so important to exercise at home, but it's hard to make recommendations about what kind of exercise is appropriate for someone, especially if someone is new to doing exercise at home. So realizing, that's a really good point, that physiotherapists are also still available, so you can still have a consult over the phone to try and determine, I'm starting a new exercise routine at home, what's appropriate. Should I be getting low weights or no weights? Should I be, how do I mimic what I've maybe been doing in person here without necessarily that guidance? And there's also helpful resources. Again, some of the information that's on the Parkinson's connection page is, again, kind of tips for if you're going to be doing exercise at home, some careful things to be careful of, and make lots of space. Physiotherapist recommendations about what kind of environment you should be creating when you're doing those exercises at home.
Yeah, good point. You want
so we're seeing here. Sorry, go ahead. I'm going to take.
You go ahead and read, Maria, and I'll just want to just echo that being safe is so important. We don't want anybody having any falls. You need to be, seated exercises may be a good option. And again, as Maria said, making sure there's nothing you can trip over while you're doing your exercises.
Yeah, exactly. Thanks, Shannon. So one of the things we're getting here is actually just a really helpful reminder for people who have had DBS surgery, making sure that your DBS is charged, and keeping any items that you might need, your charger and your plug, almost like we have our Act on Time kit. In case you do have to leave home with short notice, making sure all those things are easily accessible. That's a really great suggestion. Thank you to Russ for that. That's really important. And we are also having questions from clients who maybe had some procedures lined up for their DBS surgery, like getting a battery replacement. I don't know what is happening with those kinds of surgeries. I'm not sure if they're, so reaching out maybe with a lot of notice to your surgical team, if you had a procedure lined up, is that still on? What are the suggestions, and what's happening there? Is another good point, is also making sure if you have something coming up, you check with your team on that. But also that really good suggestion of, in case you do have to leave quickly, having those things really easily accessible. And Shannon, are you able to talk a bit about our Act on Time program, and how that could potentially also be something to kind of have lined up for clients?
Yeah, so we have a new Act on Time program. It's a folder that's and it's all online as well. So it really just gives you some helpful tips in the healthcare setting. In a hospital, there's a hospital notification sign that can explain just how important it is to get your medication on time. Some medications that are not for people with have Parkinson's, the interact with medication. So if there's something that is 1-800 number 565-3000, and we can direct you to the resources online. And we aren't able to get into our offices and have access to all the hard copies right now, but as soon as that is available, we will mail them out to you. So it's a great tool to have, just to really educate the healthcare professionals about the needs of somebody with Parkinson's, and really need to get their medications on time every time. Is there anything else you want to add to that, Maria?
No, I think that's great. And yeah, we can, if you're calling in, we can have a conversation about what kinds of tools would be most appropriate. There's a number of resources. It's really a full package of medications that might interact, those notifications, again, for, it's important to get our medication on time and those kinds of things. So we can definitely be helpful in that sense, in tailoring, directing you on our website what is the most appropriate piece to print out at right now, and then hopefully sooner rather than later we can start mailing those out again, because they're a really fantastic program. We're having a really quick question that I'll just jump in. Someone is asking if our helpline is open 24 hours a day. So no, it's not. You can always leave voicemails, and you can always email, of course, 24 hours a day. But it is only sort of being responded to during working hours. So that's how it works. There's a couple of us, I guess, to kind of explain also how our helpline works. Our helpline is available for Canadians all across the country, people living with Parkinson's, people caring for someone with Parkinson's, healthcare professionals, anyone who needs any help from our helpline can access us. There's only a couple of us, so it's not an immediate hotline where someone picks up the phone right away. Sometimes there can be queues. Sometimes we can have a lineup. I know I have quite a number of emails sitting in my queue right now that I'm going to get to just after this. So it might take a couple of days to hear a response from the helpline, just because it's Canada-wide and a small team. But it should be a couple of days. We will be getting back to you, even if we're not immediately with the answer. We'll at least let you know, hey, we got your message and we're going to connect with you. It might just need a bit more research. But it isn't a hotline, so it isn't an immediate response, and it's not 24 hours a day. And the thing that's really important is, like we said, we're not able to provide medical advice. So it's not a crisis line. So if you're experiencing an emergency, it would be better to call 911, because we wouldn't be able to respond to a crisis. And if you called us with an emergency, we would probably tell you to call 911. So there is the distinction of the helpline and a hotline, which is a bit more immediate and more for crisis and emergency. But that's a really great question. Thank you, Charlotte. Oh, sorry, yeah.
Can I make a comment? That is a good question. And there are distress lines, crisis lines that you can call if somebody's having some anxiety in the middle of the night. You just look up and have that number handy, or if you need help looking them up, just give us a call after, and we can help you with that. So sometimes the nighttime is hard, and when we're not open, so there are the distress crisis lines.
That's a really great point. Thanks, Shannon. That's yeah, important to think those are the alternatives, especially at nighttime or Canada-wide. If your hours are different from our hours, those kinds of options are also really helpful. I think we have one last question that we'll get to right now, and then we'll wrap up here. So someone is asking, if there's a new diagnosis, but because of COVID-19, not being able to access doctors. That's definitely a question that we're receiving right now. And what can someone do? So it's a new process. So, with this new situation. So the first thing that you can do is call us. Call our helpline or email us, and we can really get you set up. Like we said, we're not able to mail stuff right now, but there's a lot of really helpful information that we can email you to teach you about Parkinson's. I think COVID-19 or not, the really important thing is to start educating yourself to learn how to manage Parkinson's and what it entails. So we can get you set up with those educational pieces. We can talk about what symptoms you're experiencing at the moment and give some suggestions on that. Depending if you're on medication or not, we can sort of provide some guidance there. As far as what to do, I think what kind of has been a lot of the theme for today, exercise is so helpful and so important for Parkinson's. So as far as new diagnosis, what's my first step? I think it's about starting to establish an exercise routine. And Shannon made a great recommendation. You can try reaching out to physiotherapists in your area. If you don't know where those are, you can reach out to us and we can try and help you find one. And some are doing virtual. So accessing those resources to get you set up to do exercise as effectively as possible, I think that's a really big, important piece to establishing yourself with a new diagnosis. Shannon, do you have any other things you'd like to add?
I think it's important to note that there is a long wait list to see the neurologist with a new diagnosis. And so being patient is the one thing that we all need right now. So it will take several months to see a specialist, and it can range from anywhere from 6 months to up to 18 months. So you can check in with your family doctor to ensure that referral is gone through, and maybe your family doctor can maybe advocate on your behalf, or someone in the office can advocate calling the specialist office to find out at wait times.
That's a really good point. Managing those expectations about when you may be able to see a doctor again, COVID-19 or not. And I think one of the ways that I kind of envision what we do and how we can be helpful is I almost think of us as sort of that middleman. It may be a while before you see your doctor, get to see a doctor, and even the frequency with which you see a neurologist might take a while. So we can kind of be that in between appointment supports between you and your doctor, and explaining if there's something you didn't understand, or helping you prepare for a doctor's appointment, helping you sort of maybe talk out everything and then figure out what to say to the doctor, or try to understand what the doctor said to you. The other thing is that Parkinson Canada has that I think is so valuable, because again, we're in this situation where sometimes it is hard to access the specialists. Parkinson Canada has resources that are geared towards healthcare professionals. They're amazing. I use them all the time. I have one right here beside me in case I got any stumpers. And one that came out recently that is super valuable is the Canadian Clinical Guidelines. There it is. Yeah. Canadian guidelines. I'm messing it. So that's really helpful. So again, if you're only able to talk to your family doctor right now, and understandably, family doctors are, they know everything, a lot about everything, but maybe not as much about the nitty gritty of Parkinson's. We can also support you in that sense by getting your healthcare professionals more information to make sure they're able to manage your care as best as possible. So that's another way that we can be helpful, especially in this circumstance with COVID-19, where maybe you're not able to access all of your healthcare professionals, making sure the ones that you can be in contact with are as equipped and knowledgeable as possible to, again, make sure you're getting the best care. So I think that that's another really important piece and value. So yeah, if someone is newly diagnosed, there's a lot to that, and we're here to help out. And so please reach out by phone or email, and we can figure out what's the best stuff to get you started.
Just
Yeah.
to echo what you said, Maria, knowledge is power. And so really being able to read up, and our resources that we have are excellent. We have a really good book. It's called The Introductory Guide. I have it right here. I can show you. Here we go. And now you've got yours there too. It's such a great tool, and so many of our members have read it and just called me back. It's such a good book. So learning as much as you can will give you will going in with the questions you can ask, and so pulling us as well. We can go somebody more Parkinson's and just review some of those things with you and some tips along with that.
Awesome. Thanks, Shannon. That's a good point. Also, the intro guide is a great one as well. So I think we're going to wrap up here. We're getting towards the end of our time. Just as we're going, first of all, again, thank you so much to everyone for chatting with us. It was nice for us to feel connected to you, and I hope it was helpful for you guys as well. Just one of the things that I wanted to say, kind of again echoing what we said at the start. Shannon, you'll know this as well. Sometimes when we talk about Parkinson's, we talk about Parkinson's as like an iceberg, right? So above the water, there are these visible symptoms, a lot of them being motor, but underneath there's a lot more going on. Some of those motor symptoms can be causing internal issues. There's a non-motor symptoms. So there's a lot more going on under the surface, I think, with Parkinson's. And one of the things that I feel with our I&R calls and the calls that we get is it's very similar. There's the question that we got in the email, the voicemail, the comment box here that's very superficial, just a quick question, whatever it is. But underneath, there's a lot more going on depending on the parameters of the Parkinson's, depending on the supports that are available to the individual, and just really everything to do with their life circumstance. So, you know, sometimes I&R needs to be a really individual approach. So, you know, this is a new way of reaching our clients. I hope it was helpful. But if you're hearing these questions, some of the questions that you had today, and, you know, it was helpful, but, you know, maybe the knot in your stomach is still there, maybe it wasn't the full answer that you needed, we're also here to kind of have a really individual and tailored conversation to get to everything that's happening under the surface in your particular instance, whether you're a person with Parkinson's or someone caring for a person with Parkinson's. So again, our helpline number is there. Our email is there. We're here. And again, we're here to make sure that we're able to connect with you in a lot of ways, but also making sure we're connecting with you in the best way that's needed for your situation. So just want to make sure that everyone knows that, you know, we can also always circle back to us after this.
Yes, thank you. That's great. Please call us. We're here to help you, to support you. And I just wanted to say thank you for joining us. I see on our list there's something from UK, Newfoundland. That's awesome. Canada. So glad you join us.
Awesome. Okay, well, Shannon, enjoy the rest of your day. Everyone who's tuning in, enjoy the rest of your day. And thank you again for tuning in.
Thank you. Okay, bye.